Welcome back to a new video. You might have seen recently that I posted my surgery recovery from urostomy surgery, which I had done at the end of last year, so December the 12th, 2024. I had my bladder removed and a stoma made on the basis of having Fowler syndrome. Basically, Fowler syndrome is a problem with the urinary sphincter, so your urethra. And I went into retention one day, meaning that I couldn't go toilet, I couldn't wee at all, and I never regained the ability to wee again. I tried a lot of different things, nothing was really helping, and because of how severe and consistent my infections were, and my catheter couldn't be used any longer, it was decided finally that I would go for urostomy surgery, otherwise known as a partial cystectomy and ileal conduit. I have had quite a lot of questions recently about my recovery, the surgery, all different bits and bobs, so I thought I would sit down and do a Q&A and just kind of go through how urostomy surgery is, how my recovery has been, and I hope that this might help some other people out there going through something similar. I do know there is not actually a lot of content out there about urostomy surgery, especially from a patient perspective, so I really hope that this may help you. Obviously, before we start, I just want to know, obviously, I'm not a medical professional. This is not medical advice, this is just my own experiences, and yeah, let's get on to it. So, as I mentioned briefly beforehand, my reason for surgery was Fowler syndrome. I had a catheter in place, specifically a suprapubic catheter, which basically goes through the wall of your belly and straight into your bladder. I was getting consistent infections that weren't being treated. I had a lot of antibiotics last year, and it was just decided that that couldn't be a long-term option, and we had to try and find something that could be a lot longer term. So that is where we fell with the urostomy, and that was something that was decided at the end of last year, having my surgery in December of last year, so just 4 months ago. So prep for surgery, I had roughly 2 months to basically get prepared for surgery. I was given my final date in October, and as I said, my date for surgery was the 12th of December, so I roughly had 2 months to prepare. I had the conversation with my consultant in roughly August time, so it's not as if I didn't know it was going to happen, but I got my final date in October. Prep for surgery, I would just highly recommend to get moving as soon as possible, as much as you can before surgery, because after surgery, it is definitely beneficial. I would highly recommend kind of getting your hospital bag ready slowly. I decided to not do my hospital bag all at once on one evening quickly before surgery, just because it was a very overwhelming process, and emotionally it took a lot out of me. So by having, lots of different time to just really reflect, I wrote lots of lists of things I'd need. I went out and did shopping for like new pajamas, new slippers, and just having time to sit down and process it was really beneficial. So I would highly recommend that. Please let me know down below if it would be helpful for you guys to have a packing guide. I did pack my bag in advance, and I'm more than happy to share roughly what I pack on a hospital admission. So again, do let me know down below if you do want to see that. One of the questions I've been asked on my Instagram is, where is my stoma placed? Did I have a say for my stoma placement, and am I happy with my stoma placement? So my stoma is placed on the right side of my belly. It is along and slightly down from where my belly button is. For my stoma placement, I went to see a stoma nurse at my pre-op appointment. At that appointment, I was wearing exactly what I would usually wear. So I usually like to wear high-waisted clothing, fitted clothing, and just whatever my usual outfits are, I tried to stick to that as much as I could for this appointment. During that appointment, she had me bending, twisting, sitting, all different movements to kind of see where my body bends, where my rolls are, where creases are, just to try and find the best placement. And where I actually have my stoma was pretty much exactly where I was marked up for with my stoma nurse. I can hand on heart say I am so happy with the placement I had got. I have had some leaks, but it's not due to placement. It's just rather my stoma is quite flush to the skin. I've not had any problems with my body shape, with dressing, with kind of anything placement wise. I feel like I've been very lucky. I'm very happy where it is, and yeah, I don't have any problems, so I can say I am happy. I did have somewhat of a say because obviously I said to her what type of clothing I wore, how my life is, and like she said, am I happy with that placement? I felt very happy with that placement, and of course, yeah, she had me bending just to make sure it worked out well. I was going to share some basic surgery details. So my surgery was just under 6 hours long. I was told at pre-op it was only going to be a 4-hour surgery. However, it was just under 6 hours. I was second on the list for that day, and I roughly went down about 11, 12, I believe. Leading up to surgery, I had seen a main anaesthetist and my surgeon. I'd basically gone through my consent forms again. My anaesthetist was a bit concerned for me because of how many pain relief allergies I have. So we tried to come up with a plan that they were happy with and that I was happy with leading into surgery. Surgery was open, so it wasn't keyhole. I have a straight scar from here all the way down. I was opened up. I had I believe I had 30 staples on the dot. So it was a big incision. I then had a stay in ICU/HDU. I believe they're at the same block for the hospital I was at. I was only supposed to have a 1-night stay in ICU because of the surgery I had. It was only planned for 1 night, but because of the pain I'd had and it not really being controllable with the medications I was given, I ended up having, I believe it was 5 days total in ICU. It was pretty much just one-to-one nurse care. In the ICU, they were helping me just to clean, function, drink, just every basic, because at that point, just sitting up was hard work, just being was hard work. For me, the ICU was quite traumatic just because of the amount of pain I was in, and the pain medications I was finally given were very strong, and they weren't a very nice experience and quite a traumatic one. So ICU wasn't great for me. I mean, some people get out of ICU and recover really quick. Some people take a bit longer. Mine wasn't necessarily straightforward, so that was kind of that experience there. I have been asked on my Instagram, when did I have the surgical drain out and when did I have the urethral catheter out? So during surgery, I did have a abdominal drain placed, and then, like I said, I had a urethral catheter placed. A urethral catheter, I believe, was the last drain to be taken out. So my first drain, I believe, came out on day 3 or 4. It might have been day 4. Just as there wasn't really much coming out of it. There was a bit of blood, but again, it didn't really drain too much. So that had came out just before I'd left ICU, so I think it was the day before. And then the urethral catheter, I believe, came out the day after, or maybe 2 days after. I also had an epidural in, which again was removed on the last day of being in ICU. For me, it was quite a shame because I'd had the epidural as hopes for basically pain relief post-surgery, and the epidural actually wasn't placed in the right place. All my legs were numb. I couldn't move my legs for a good amount of time in ICU. However, none of my abdominal area was numb, so I was in a lot of pain and just couldn't move my legs. The epidural was great for putting some medications down that could be used by an epidural, but the actual numbing of the epidural, it didn't sadly help for me. Another question I've been asked is how long after surgery till I felt a bit more human. I can't lie, it's been a very hard one to kind of gauge for that. Post-op, I did have a infection in my wound, so I sadly had my wound open up during the recovery process. So what was a initial recovery period kind of was slightly altered It took 7 weeks for me to have the incision fully heal. And again, that took a long time. I was having district nurses out, and then I had to go to my GP to get those changed every 2 days. So the initial part of recovery, I'd had some complications. My bowels weren't very happy post-surgery, so I had a 12-day stay. So I was discharged on Christmas Eve. I was then readmitted Christmas Day and then discharged on the 27th. So I was in and out a lot. In January, I was in and out a lot because I had some complications. And again, I had an inpatient stay at the end of January, I believe. So I didn't necessarily feel human for a good amount of time. It was very surprising just how quickly I was recovering without realising. So in those first 2 weeks, the pain from just moving to then being able to sit up, to then being able to stand and walk, that was very quick, almost unexpected. Like each day there was definitely a difference. And again, I look at 1 month post-op versus 2 months versus 3 months, now versus 4 months. I can definitely see a lot of different changes. Would I say I have felt fully human? Probably only fully maybe from end of February onwards. But again, I've not really had a consistent week, I wouldn't say, since surgery, just because of quite a few of the problems I've been having. Sadly, I've also had quite a lot of ongoing urethral pain, so surgery didn't cure that for me. So I am still trying to juggle that and kind of deal with that at the moment. Another one of the questions has been, do I have any tips for getting active again after surgery? And as I mentioned earlier, part of surgery, a big thing is actually being active beforehand, because the more you strengthen up those muscles, the easier your recovery will be on the other end. I would recommend to just get moving as soon as possible, which sounds crazy. I was very harsh on myself with this post-surgery, and I probably should have been a little kinder on myself, but it was very important to get up and moving, because as soon as you're up and moving, that pain does shift a bit. And the more you're moving, obviously, the quicker hopefully recovery will be. So my biggest tip is to try and push through it where you can, but in the same vein, don't be harsh on yourself, because I felt like I was very harsh on myself and it probably wasn't that beneficial. You know, it's a big surgery. It's okay to just need to sit down and recover. Like, it's a big deal. This is one question that I wanted to include anyway, but I did get asked it. What was the most unexpected part of surgery? And was there anything I wish I knew going into the surgery that I didn't previously know? So for me, I would say one of the biggest parts was actually the incision. So I went into it kind of expecting a larger incision. You know, I wasn't really going into it thinking it'd be tiny. I know it would be a bigger incision. However, I didn't realise just how low the incision would go. So I was kind of expecting pretty much at the bottom of my belly to be the end, but it goes very low into my pubic area. And that was something I did not expect at all. It was a bit of a shock post-surgery, and it made me very emotional just because I think it caught me so off guard. So that was one thing that definitely I wish I knew. I wish someone had said to me kind of what to expect it to look like, because, you know, I didn't know. As well as I had 2 stents placed during surgery from my kidneys into the stoma, and basically you could see them on the bag that I'd had. I didn't really know too much about them going into surgery. I knew I was going to have them, but I didn't really know too much. Having them was very strange, and I was having a lot of pain, which we think was potentially from the stents. So once they were out, you know, it was then a bit kinder on my body. It felt a bit better. I wish I just kind of knew the whole process of having them. I didn't really know what I was going in for. It didn't hurt to have them removed. I did have a bit of right-sided kidney pain, but they did find on the CT scans I'd had that there was a bit of swelling from likely the stent. So that was a bit of a surprise. And again, it was a bit ropey, but we got through it. I would want to add in a little tip that I was given at surgery, and I'd only had one other doctor give me this tip post-surgery, but I'd already known about it, was pack chewing gum for this surgery, or when you have major surgery, or any surgery for that matter. Chewing gum helps trick your bowels into thinking it's eating, so it needs to be moving. So when your bowels are struggling to wake up and you need to go toilet, and you can't go toilet, Chewing gum really helps with kind of getting things moving, so I would recommend that. The next question is, do I regret surgery? Hand on heart, I don't regret my surgery. As simple as an answer, no, I don't regret it. If I want to go into it more, I didn't have my urethra removed during my surgery. I just had the majority of my bladder removed. They left the base, which basically meant they left the urethra in, and I've been having ongoing pain. I've further discussed this with my consultant, and he doesn't think that's really an option for me. However, I do wish this was discussed a lot more before surgery, and I wish I had a bit more option in whether they removed it or not, which obviously they didn't. However, I've only had one, we believe, infection post-surgery, excluding the wound infection, just on a UTI basis. But again, it wasn't really that big of a deal, and I think it's pretty much cleared up. It's a lot easier for me than the suprapubic catheter, and yes, I've had some complications. Yes, there's been some problems with leaks or getting used to products, but I don't regret it. I'm very glad that I had it done, and it's one of those where realistically I wish I could have had it done sooner. It's a big deal to go through, and again, I wouldn't necessarily be like everyone needs to have this done, because it was very traumatic, and you know, there is still a lot going on behind the scenes emotionally, physically, but for my Fowler syndrome it has been really helpful and I can't really complain. I have some other questions I got given on my Instagram. One was, how did you go from an SPC to urostomy, so suprapubic catheter? What was your life like between them? So during my suprapubic catheter, I had it for around 18 months. Again, I was having really consistent infections, persistent infections, and it couldn't go on any longer. We had to find a plan, so the urostomy was ultimately the decision that was made. If I reflect on the two, I was having really painful and traumatic catheter changes every 5 weeks, because a lot of the time they were getting stuck. It has just meant my anxiety even's a lot better regarding my health and regarding my, I don't have to worry about catheters anymore. Again, I haven't had leaks, so I feel like, or at least substantial leaks, so I feel like going out and about isn't as daunting. From a pain perspective, my pelvic pain has gone, just my urethral pain hasn't, so there's a little benefit there, nothing too crazy. But again, my infections have been very minimal, so that's definitely a great bonus between the two. Someone has put, I am post-op, sorry if TMI, bowels, 3 weeks post-op and they are a mess. My bowels were not great post-surgery. I was discharged on the 24th, so Christmas Eve, as I mentioned, and I hadn't been toilet. And I was readmitted on Christmas Day in extreme abdominal pain. I genuinely was very poorly, and I was readmitted straight back to the ward, from A&E straight back to the ward. And I had to go on a very extreme laxative regime, even though I was on laxatives kind of on that 12-day admission. And then I finally managed to go toilet on the 26th, I believe. So it took me 2 weeks just to be able to have a bowel movement. It was very painful. They were a mess. They haven't necessarily been consistently okay since, so that's not amazing. However, I have kind of had ongoing gastro problems anyway, so I don't really know if I'm the standard example or not. Did mostly touch on this, but I'll quickly mention it again. Did you find it better to manage than your SPC? Definitely. I do have to change my bag every day, so because of how my stoma sits, it is best for me when I change it daily. Otherwise, I do start getting a lot more leaks under the base plate. So it is technically more high maintenance because I am changing it daily. A lot less high maintenance than the SPC for some reason. You know, my SPC, the changes were always causing flare-ups. I was very anxious about having the changes. I was always having catheter leaks, and I've not got any of that now. So I find it a lot better to manage. How long was recovery? I'm fighting for a urostomy now with my consultant. I was given a rough estimate of 6 months to be fully recovered. I'm 4 months into that recovery period. Then if I look at 4 months, I feel like there has been a lot of progress. When I look back 4 months ago at just being post-op, just waking up in ICU, when I see the changes, it's crazy. Changing my bag is just second nature now. My fatigue is very intense, but we think that might be due to another problem now. My pain, again, I don't have any surgical pain. Everything's fully healed, kind of from an outside perspective. I think it's pretty much fully healed from an inside perspective. So that's been great. It's very hard to fight your consultant for these procedures because they are major procedures and so many people are so opinionated on them. I would just highly recommend, whenever you want to go, if you believe something is right, you know your gut feeling, fight for that gut feeling, get second opinions, do as much reading as you can, and just try and fight your corner. Obviously, medical professionals are medical professionals for a reason, but you are also the expert on your own body. So just keep that in mind. And if you know why you think urostomy is best for you, write those reasons down and fight your corner. It isn't a glamorous procedure, and kind of, as I mentioned, yes, it's been great for me, but not everyone has the same experiences. And as I kind of have kept mentioning, it was very traumatic and not something that I would really wish for someone to have. So do keep that in mind. I don't really want to be scaremongering. That isn't the idea. It's just, it is a big deal, and I understand why consultants are very cautious with granting the surgery because, it's a lot to deal with. I have a couple of final questions regarding just my stoma bag. Do I ever attach the day/leg bags to my stoma bag to allow for extra drainage? No. I empty my stoma bag roughly, I would say maybe 6-7 times a day. It's just the same as when you would have went to the toilet. I don't have to change it crazily amounts. So when I go to empty it, it is pretty much the same intervals as my partner would be when he goes toilet. So I don't really feel the need to add any leg bags or day bags. If I am really struggling at home, I will just attach a night bag and I will stay downstairs and not really have to worry about getting up. As really the only times I'm really leaving the house is when I am most comfortable and most really fit. What stoma bags do I use? I currently use the Salt Confidence B soft convex urostomy bags. I highly recommend them. I recommend them to everyone that I speak to. They come in 3 different colours. It's black, white and like a nude beige colour. I do very much recommend them. I wouldn't really want to be changing my bags anytime soon. And then what is my care routine like for my stoma? I am thinking about maybe doing a full video on this, so if you would like to know anything about that, please let me know down below. But as I mentioned, I change it every day. I use my bag, dry wipes, a stoma paste, a stoma adhesive, and then an adhesive remover. If you would like an in-depth kind of example of me changing my bag, again, let me know down below. I hope this video has kind of helped you get ready for your urostomy process, whether it's you going through it, whether you're advocating for it, whether a loved one is going through it. It is a really big surgery to deal with, and I really hope that finding some information might help you, and I hope this may settle any questions you may have. Again, if you do want to ask any more questions, please just leave them down below. I'm more than happy to help. I do also post about my health on my Instagram and TikTok, which you will find here. Thank you for watching this video, and I hope to see you guys in the next one.